Good day and welcome to UroNurse News. I'm Vic Senese. Like and subscribe. What if I told you one of the most overlooked health tools doesn't come in a pill bottle? It comes from intimacy. It's no surprise that intimacy between partners can be pleasurable and relaxing, but what might surprise you is growing body of evidence showing that lovemaking offers real, measurable health benefits for the body, the mind, and the emotional well-being. Today I'm summarizing research-backed connections between sexual activity and health, and highlighting 10 medical conditions that may be helped or at least potentially prevented by regular, healthy intimacy. Let's begin with how lovemaking affects your health overall. First, physical health. Sex raises your heart rate, similar to light to moderate exercise. Supporting cardiovascular health is a part of an active lifestyle. It's also been linked to higher levels of immunoglobulin A, or IgA, an antibody that helps your body fight infections. Orgasms release endorphins and oxytocin, which can temporarily reduce pain, ease muscle tension, and promote relaxation. And afterwards, hormones like prolactin and oxytocin help the body unwind. You know what that does? Makes it easier to fall asleep. Trust me. Now, mental health. Sex lowers cortisol. Cortisol is that stress hormone. We got a lot of that going on nowadays. And it increases dopamine and oxytocin. Those are the cuddle chemicals associated with improved mood and reduced anxiety. Many people report feeling calmer, more grounded, and emotionally connected afterwards. That sense of connection can also improve self-esteem and body confidence. And finally, emotional and relational health. Oxytocin, often called the bonding hormone, deepens trust and attachment, particularly in committed relationships. Regular mutually satisfying intimacy is associated with stronger relationships and better communications. Number 10, heart disease. Regular sexual activity supports heart health by improving circulation, lowering stress, and helping regulate blood sugar. 3 contributors to cardiovascular risk. Do it for your heart. Number 9, sleeping troubles? Having trouble falling asleep? Well, sex stress-reducing effects can relax the nervous system, helping many people fall asleep faster and stay asleep longer. Number 8, depression. Are you feeling depressed, isolated? Intimacy promotes feelings of being wanted and connected while releasing brain chemicals linked to emotional well-being. Number 7, headaches. Endorphins released during sex act as a natural pain reliever, sometimes easing tension, headaches, or even migraines. It beats taking a Norco. Number 6, the flu. This one surprises many people. Studies show that individuals who have sex a few times per week tend to have higher IgA levels, which may improve immune defense against common viruses like the influenza. Now, I may be bragging here, but I've only had the flu about 3 times in my whole entire adult life. Number 5, dry skin. Increased circulation during sex helps the body eliminate toxins more efficiently, often resulting in healthier, more vibrant-looking skin. Hey, better than using those lotions. Number 4, breast cancer. Yes, nipple stimulation triggers oxytocin release, which some studies suggest may help regulate breast tissue health. While this does not replace screening or treatment, hormonal balance plays an important role in prevention. Keep that in mind. Number 3, urinary problems. Sexual activity strengthens the good old pelvic floor muscles, which can improve bladder control and reduce urinary leakage. Number 2, overworked muscles. Who doesn't have them? Muscle tension doesn't always need a massage, although it doesn't hurt. Dopamine and oxytocin released during intimacy can relax muscles and reduce joint stiffness. Here's a pill I don't mind taking. Prostate issues. Finally, your prostate health. Regular ejaculation has been associated with improved prostate function, potentially reducing the buildup of inflammatory or harmful cells. And as if you've been watching this show, you've heard some reports that I've talked about that it has a lower rate of prostate cancer for people who have had regular sexual encounters. That means ejaculations. Now, to be clear, sex is not a cure-all, does not replace medical care, but science continues to show that healthy intimacy plays a meaningful role in physical, mental, and emotional health. Connections matter. Touch matters, and sometimes the simplest health tools are really the most human. I'm Vic Senese. This has been UroNurse News. Now, get out there and do something. Hey, tonight on Dr. Jeff talks about sex and intimacy. In case you need a little help in that department, tune in. What if the real change in your relationship starts with acceptance? Tonight, Dr. Jeff sits down with world-renowned couple therapist and co-developer of integrative behavioral couple therapy, Dr. Andrew Christensen, for a powerful conversation every couple needs to hear. Together, they explore the delicate balance between acceptance and change, and why trying to fix your partner often keeps couples stuck in cycles of blame, defensiveness, and emotional distance. Dr. Christensen explains how acceptance work can soften reactivity, build empathy, and open the door to meaningful change without pressure, coercion, or perfectionism. So if you've ever felt unheard, if conflict keeps repeating, if you want deeper emotional connection without forcing it, this episode offers insight, compassion, and practical wisdom you can use. Tonight at 7 p.m., join us on Dr. Jeff Talks About Sex and Intimacy at drjeffsextalk.com. Tomorrow, hot flashes aren't just a woman's health issue, and for men on androgen deprivation therapy for prostate cancer, they can be intense, disruptive, and life-altering. So we're going to break it down with the new evidence showing that oxybutynin, a medication that you already know from overactive bladder care, may significantly reduce hormone deprivation associated hot flashes. What's the science behind it? Who may benefit? And how does it compare to other treatment options? Join me for a clear, evidence-based look at a surprising solution to a common prostate cancer treatment side effect. Hot flashes drive men crazy. Women seem to put up with them. Us guys don't, not so much. So if you're on androgen therapy, taking anti-hormone drugs, you want to catch this episode tomorrow.